Thousands of Hoosier kids already have their first dose of this COVID vaccine, and all of this comes just a week and a half into this rollout. Statewide, we're looking at about 8,700 first doses distributed. About 800 of those are right here in Marion County. The initial rush to get that shot left some vaccine sites without enough doses to go around. So tonight at 11, our Lauren Costa kicks off our big story with what parents need to know before heading to the nearby clinic.
After more than a week, some health departments are running low on the pediatric vaccine.
This is a special refrigerator. That's a freezer.
And others are completely out.
6? Okay.
Health officials in Madison and Boone counties confirmed earlier this week they used up the last doses for kids 5 to 11 and are now advising parents to find clinics outside of their county until they can get more in. And other health departments are also feeling the shortage. Hamilton County says their supply is very limited.
We had an initial allotment of 300 doses, which we went through very rapidly. We were able to get some additional doses from Indiana Department of Health, and by the time we closed down today, we should have given about 1,000 doses.
And on Monday, they expect another shipment to come in, but aren't sure how much. That's why they are only accepting kids that have appointments to make sure they have enough doses and no one is turned away. 12 and up are eligible to do walk-ins. However, until we can get that supply of the pediatric vaccine up there, right now we're doing appointments only for that group. With the vaccine supply being tight, Christian Walker suggests parents find appointments wherever they can.
It's going to take a little work on the parents' part to find those appointments, but if they can get them, by all means, grab that appointment and get those kiddos taken care of.
And on Thursday, Marion County health officials said they are not worried about their vaccine supply after opening a kids-only clinic on the west side.
So right now we seem to be okay with the supplies that are being provided to us.
To know whether a clinic offers the pediatric vaccine, look for the red marker on the state's map. You can also check if walk-in appointments are available. But remember, it's best to schedule one if you can.
Riley Hospital for Children announced a COVID vaccine clinic just for kids starting this weekend, and it's already booked up. So far, looks like the earliest appointments aren't until December 4th. Those could fill up fast. Keep in mind, appointments are required, so no walk-ins. You can check the state's website for any openings just in case of a cancellation.
Some parents right now are still hesitant to get the vaccine for their kids, and we've seen a few valid questions about the shot. So our 13 Investigates team did some digging. If you have an 11-year-old who's about to turn 12, do you get the child's dose now, or do you hold off until they're 12 and get the adult dose?
Well, what I tell parents and grandparents is not to wait, is to get whatever vaccine they can get.
Doctors say if a kid gets the child dose for the first shot, they'll get the same dose for their second shot, even if they turn 12 in between. Another parent asked us, has the child's vaccine been verified for use on ADD children? Dr. Christensen says right now the research on that isn't that specific.
Now, looking at the millions of doses that have been given to individuals over 12 years of age, there hasn't been shown to be any problems with those particular groups of people.
Our 13 Investigates reporter Sierra Putman has answers to other common questions from parents, and you can read her full report right now online at WTHR.com and also on the WTHR app. And that's a wrap of tonight's big story.